Hello, Mr. Rogers. It's nice to meet you. I'm Rena Jones. How are you feeling today?
I'm fine. I'm just a little bit nervous. I've never done anything like this before, so I'm not really sure what to say.
That's understandable. Can you tell me why you come in to see me today?
It wasn't my idea.
Whose idea was it?
Well, it was my doctor's. I've been having these chest pains, and all the tests I've had said basically there's nothing physically wrong with me, and so he thought it was a good idea for me to come and talk to someone about how I was feeling.
Okay, and that makes you feel uncomfortable coming to talk to someone?
Well, yes. It isn't something I have much experience in doing.
Okay, well, why don't you start by telling me a little bit about yourself?
Well, I'm a businessman. Well, I used to be a businessman until last year. I retired from a large multinational corporation. I was the account manager for the Eastern Europe for the past 15 years.
Wow. You must have seen a lot of changes in that part of the world.
Yeah, it was really exciting, always changing. It was always challenging.
Why did you retire?
I'd always planned to retire at 64. It had been a goal of mine for years, and my wife is retired, and we thought we'd travel and do all the things we never seemed to have time to do.
Right. Well, I'm going to go back and ask you about your health. You had mentioned some chest pains that you were experiencing.
Well, that's sort of been a big problem over the past year. I've been in and out of the hospital a couple times and had all the tests, but nothing showed up on them. And my doctor says I'm fine, but I still keep having these chest pains.
Okay. Do you have any other health concerns you might be worried about?
Well, just like the chest pains, I always seem to be so tired. I mean, too tired. And, I seem to have lost all the energy I used to have when I was younger. And maybe I should just settle down and accept my age.
Okay, accept your age. What does that exactly mean to you?
Well, I'm 65. I'm not 25 anymore, and I'm tired, and I really don't care about much anymore.
Are you surprised to hear yourself say that you don't care anymore?
A little, because I never expected things to be like they are. But at 65, I guess I have the right to be a little tired and not care.
Okay. Well, when you say your expectations were not what you expected, what were your expectations for retirement?
I don't know. I didn't expect to feel so out of it, so isolated in a way. I guess I didn't expect to feel so old.
Okay. Tell me a little bit about your day-to-day life. Why do you think you're feeling so old?
Well, I don't do that much anymore. I mean, I guess I didn't realize how much of my life was wrapped around work, with all the meetings and the people and the events and just the day-to-day operations of what I did. And now that those things are gone, I don't seem to have that much to do, and I don't seem to have the people around me like I used to.
Right. Well, you mentioned that you were looking forward to spending time with your wife during retirement.
Yeah. Yeah, we were looking to spending a lot more time together. And not to say that we don't spend time together now, we do, but the times aren't the way we wanted. Her illness has stopped her from getting up and going out and basically enjoying the things we had planned to do.
I'm sorry to hear that. It sounds difficult.
Well, we never expected her to be so ill. I mean, it came on so suddenly, and it's confusing for me because some days she seems so good, almost like she was, and the next, she isn't able to do much at all. It just seems like we're two old people sitting in the house watching the TV, And that's not what we planned. It's a complete change of what we had hoped our lives would be.
Now, does your wife require a lot of care at home?
Yeah, we have to have a healthcare person come in 2 to 3 times a week. And my wife can walk and do a few small things, but things like taking a bath and some of the things, she has to have help. And I try to do the cooking and the cleaning, but
yeah,
I'm not very good at that.
It's a lot of changes.
I wasn't home alone, so it's a little bit different for me.
So it sounds like you've had a lot of major changes in your life in the past.
Well, it's so many changes that it doesn't even seem like my life anymore. I mean, I feel so overwhelmed by it. I opened the closet door. One day, I opened the closet door. And I saw my suitcase and the travel kit inside. And I didn't even recognize it anymore. It was like that part of my life was over 1 million years ago. And I don't even know whose life I'm living right now, because it definitely isn't mine.
Well, it sounds difficult and upsetting for you, what you're going through right now. Have you had any problems sleeping that you've noticed?
Well, that's another change. I don't sleep well at all. I'm constantly worrying about what's happening to me, what's happening to my wife. I mean, sometimes I blame myself. Did I do something wrong? Because how did we get into this mess that we're in?
For someone who's been so successful, I understand this is just new and uncomfortable for you.
I can't tell you how unsettling it is. I feel so lost. I mean, I feel so unhappy about everything that's going on. You're young, and you cannot understand how awful it is to get old. Here I am, someone who used to manage a division of 50 people, sometimes even more, up to 70. And I can't even tell you what day it is anymore. Sometimes I feel like I just can't go on.
Well, what do you mean by that you can't go on?
I don't know really. I mean, it's really nothing. It's just sometimes tough going from day to day to day.
Okay. Well, for me to better understand what you're going through, I'd like to ask you a set of 15 questions. It's something I do with all my clients in the first visit. Is this something you'd be willing to do?
Look, I'm not really interested in any psychiatric diagnosis.
That's not my purpose at all. These questions will help me to get a better feeling of how you're feeling and to maybe discuss some of your goals.
Okay.
Okay? All right, thank you. Choose the best answer about how you think you felt in the past week. Okay, the first question. Are you basically satisfied with your life?
Haven't you been listening? My life really isn't really good right now.
Okay. It may seem like I'm not listening, but it's just for me to get a better understanding of how you're feeling.
Okay.
Have you dropped many of your activities and interests?
Like I said, my wife has good days, but mostly the bad. She can't get around, so most of our daily activities, yeah, we've had to drop. We've had to basically stay home.
Do you feel like your life is empty?
No, it's not empty. I mean, I still have her, and we still spend a lot of time together, but it's just not the way we planned it to be. I mean, no, it's not empty.
Do you often get bored?
It would be wrong for me to say all the time. I mean, you can only sit in the house so long. I mean, I try to putter around. I try to do the things I need to do. I mean, but it's compared to what I used to have. Yeah, it's boring.
And like I said, it may seem like I'm not listening, but I'm going to ask you again. Are you in good spirits most of the time?
What do you think?
Are you afraid that something bad is going to happen to you?
No, actually not, because it's already happened. I'm more concerned of what bad is going to happen next.
Do you feel happy most of the time?
Can't even really remember the last time I was happy.
Do you often feel helpless?
It's really the wrong word. I don't feel helpless right now because I can still take care of things. It's more like as I get older and older and older and older, am I going to be helpless then? And so I'm more afraid of being helpless in the future.
Do you prefer to stay at home rather than going out and doing new things?
No, I would really prefer to go out. But just like I said before, we're not in that situation where we can just pick up and leave and do what we need to do. To have the fun that we plan to do. I mean, our life sort of dictates what we do.
Do you feel you have more problems with memory than most?
Did you ask that question? I do. And it's just the monotony of the day. I mean, you're home all the time. You cook your meals, you do your laundry, you clean the house, you work on the yard a little bit. But one day runs into the next, and so I'm starting to have a hard time remembering things. I'm not taxing my mind like I used to.
Again, you may feel like I'm not listening based on this next question, but it's just for me to get a better understanding. Do you think it's wonderful to be alive right now?
No.
Do you feel pretty worthless the way you are now?
No, if it wasn't for me, I don't know what my wife would do, so I'm not worthless. I have a lot to offer, but nowhere near what I could be doing.
Do you feel full of energy?
I feel like I don't have
Do you feel that your situation is hopeless?
a little bit. I mean, you never know what's going to happen from day to day, but since you're asking me today, yeah.
Do you think that most people are better off than you are?
Yes.
Okay, well, thank you. I know that was a lot of questions, so thank you for answering all of them.
Well, thank you for listening.
Mr. Rogers, I'd like to ask you a series of questions. It's routine. It's something I do with all my clients on the first visit. Would that be okay?
That'll be fine.
Okay, let's get started. Have you ever felt so blue or sad that you thought you would hurt yourself?
Yes, I've felt like that sometimes.
Have you felt like this in the past 2 weeks?
I've felt very discouraged, very depressed. I feel I really don't want my life to go on like this.
Do you feel like hurting yourself now?
No, not now.
When you were feeling so sad that you couldn't go on living like you are now, did you have a plan to hurt yourself?
Well, I've thought often that both my wife and I would be better off if things would change. And we never planned to live our lives like this, so I thought one time if I gave her a large dose of pain pills and then took them myself, well, bottom line, we would be together and all this suffering would be over.
And do you have medication saved that would enable this plan?
No, but we always have pain medication around and it wouldn't be difficult to get. We could do it if we wanted.
Have you thought about how others might react if you died?
No. never really thought of that.
Have you thought of any problem or situation that would signal you, that would put your plan into action?
Oh, do you mean, have I ever thought of what would be the last straw to set all this off?
Yes.
Not really. I just know we can't go on like this.
Have you ever tried to hurt yourself in the past when you were younger?
No.
Have you tried to hurt your wife in the past when you were younger?
No, I would never hurt her. I would never hurt her. I just want her to be free of this whole situation.
Mr. Rogers, do I need to be concerned about your safety in this next week?
No, not really.
Would you please promise me then to call myself or someone in the office if you feel like there's no way out?
I promise.